So a lot of women ask me, what does a healthy period look like? They've heard me talk about how it's so important to have a healthy period, and that is the first step to having a healthy fertile cycle. So naturally, they want to know, what does a healthy period look like? So you're probably wondering this as well. And first of all, I just want to emphasize why it's so important to have a healthy period, because this is when your uterus is cleaning itself out so that implantation and pregnancy can occur. If your uterus is not cleaned out and there's a lot of residual tissue that hasn't sloughed off, and you may have some polyps or scar tissue or other accumulations that would block being able to have a healthy implantation occur or pregnancy, so that the embryo, that your little growing baby, can get really healthy nutrients and secure itself to your womb. So it's really important to have a nice clean uterus, and that is the job of the period, to clean the uterus out, right? But also during your period, the body's giving you really important feedback, revealing just how fertile your cycle is. So if you have a lot of clots, or you have a lot of pain, or your flow is really dark, or your flow is really light, or your periods are super heavy, or your periods are super light, then these are clues that your body is giving you about how fertile you are, how healthy your cycle is, how fertile your cycle is, and so forth. So period is really important. There's a lot of really important information, and there's also, it has a really important job to make sure that your uterus is nice and clean. So just to give you some general guidelines about what a healthy period looks like. First of all, we'll talk about length. So I like to talk about the length of your period, the amount of flow you have, the color of your flow, the texture of your flow, how frequent your period is, and how severe the signs are. So these are the 6 major categories that I'm looking at when I'm looking at the health of a period. So let's start with the length of your period. You should have about 2 to 4 days of substantial flow without spotting beforehand, maybe just a little bit of spotting, but generally your period should just kind of kick in and the flow should start. And it's completely normal to have some spotting after your period begins to taper, but it should be mild. It shouldn't go on for days and days and days. It should take about a day or two to taper after the flow has tapered off. And so by substantial flow, I mean enough of flow to actually warrant needing a pad or a tampon to wear something, or if you use the Diva cup. Yeah, I don't generally go by teaspoons, because who actually measures their flow with a teaspoon or tablespoon, right? So I would say it should be enough to actually need to switch out a tampon or a pad at least 2 to 3 times a day, but not so heavy that it's difficult to manage your flow and that it's just overwhelming and you're leaking and you can hardly keep up with it. So you should have about 2 to 4 days of substantial flow, and it should be a moderate amount of flow. And then we go for color. So the color of your flow should mostly be a deep or fresh red. Now, of course, it's normal for it to, when it's tapering off, to be a little bit on the brownish side. But in general, or have maybe a little bit of darker color red or maroon color. But in general, the majority of the flow should be a fresh red, or like a deep fresh red color, not so blackish or really dark red or brown or maroonish. If a lot of your flow is kind of like a darker color like that, then that's an indication that there's some, that you could have improved circulation to your uterine lining. Now, the texture of the flow should be thicker than blood, but not necessarily like mucus. And if it's normal to have some clots, but it should be mild clotting, just like a few small clots, like pea size or smaller. But if you're having a lot of clots or a lot of clumps of tissue, or it's very mucousy, then that's not ideal texture. It should be thicker than water, have some substantial weight to it, but without it being like a clotty tissue mucousy. Then the frequency, you should be getting your period every 28 to 32 days. If you're getting it less than 28 days, if you're getting it 26 days or 25 days or every 23 days, then that means your follicular phase is short or your luteal phase is short, or possibly both phases are short. So you really don't want it to become any less than every 28 days and no longer than every 32 days. So that's ideal that it comes within that 28 to 32 day window. If it was picture perfect, textbook perfect, it would come every 28 days. But of course, we're not always a textbook. We don't always get it perfectly on the dot every 28 days, but that's the ideal. If you have PMS symptoms, of course, it's normal to have some mild bloating, cramping, low back pain, and so forth. But the severity of the symptoms should be just that, mild. You should ideally not need to take any ibuprofen or any kind of medication like that, and it is best to avoid it if possible. Sometimes you have to take it to get through the workday or just to function, but if you don't have to take it, it's better to use a heating pad, something else to manage any discomfort, because medications like ibuprofen, Motrin, etc., Tylenol, these things can actually disrupt your hormones and can actually also stop your flow so that you're not cleaning your uterus out effectively. So if it's at all possible to avoid taking those medications, then I would encourage you to avoid taking them. But in general, a healthy period would not have very severe symptoms, but just mild, normal symptoms that can come with a period. All right, so that is a summary of what a healthy period should look like, a very common question that I get. And of course, a healthy period and a healthy cycle is one of the most important steps to getting pregnant. It's the foundation of your body being pregnancy ready. In fact, this is the first step in my 4-step method to getting pregnant in an easier, healthy, and more affordable way. The first step is to establish a healthy cycle and a healthy period, and learn how to read the signs that your period is telling you about your fertility, about your ability to get pregnant, and about your general health. Our period actually tells us so much about the health of our whole body, like our digestion and so forth. Our periods have a lot of information. So in my program, Fertility Activation Method, my online program, the fertility pressure points I teach help to bring the 4 phases of your cycle and your period into balance. So if you want to learn more about my 4-step method to getting pregnant easier, healthier, more affordable way, then I would encourage you to sign up for the masterclass. You can sign up for the masterclass in the link above this video. All right, I'll see you over there in the masterclass.